Leanne looks closely at how the pediatrician examines her small brother. Then it's her turn. The Alameri family has today come with their children for an early detection examination in the surgery of Dr. Claudia Hamacher. I am very pleased that there's always a pediatrician available. We parents are helped and my children are helped. I am very pleased that my children are healthy, as the doctors here always take care of our children. In the early detection examination, the pediatrician also speaks with the parents about nutrition and digestion and about accident risks. If the babies cry a lot, she gives the patients tips why this is and what they can do.
I am always happy when families take advantage of early detection examinations. Then I can do the physical examination and also examine whether the children are developing age appropriately, which, for example, he is. You can see, for example, now as he should, he can raise his head perfectly, and he can even squeeze with his hands.
When the Alameri family come to the surgery, they always bring the yellow examination record and the vaccination card with them. In the document, the doctor sees whether the baby has already been vaccinated. Today, Yusuf will be vaccinated against polio, amongst others. This vaccination must be given again in a couple of weeks, only then will it be fully effective. The early detection examination U4 is one of a total of 6 examinations for children in the first year of life. When the children are older, the intervals will be longer. At the age of 2 to 5 years old, there are 4 additional examinations. Between 7 and 10 years of age, there are 2 examinations. Juveniles can go to examinations J1 and J2. All examinations are free. However, one should always take care of making an appointment in time. Finally, it's Leanne's turn. She can already really take part. Hopping on one leg goes really well. This shows the doctor how nimble the 5-year-old is already. Previously, Leanne had already had a hearing and seeing test and repeated words. She had a lot of fun doing this. All early detection examinations are very comprehensive. The doctors check whether head, back, arms and legs and the interior organs are developing correctly. Also, whether the children can see, hear and speak well plays a role, as does whether they are able to concentrate well and how they behave towards others. No examination is the same as another, as the children become older and something else is important each time. Everything goes well for Leanne, and she is fully healthy. But that is not the case for every child.
Wenn ich feststelle, dass ein Kind Unterstützung braucht, gibt es verschiedene Möglichkeiten.
When I establish that a child needs an examination, there are many ways to help. For example, in simple cases, I can give the parents tips. I can prescribe various treatments, such as, for example, speech therapy for children with speech anomalies. I can prescribe movement therapies, such as physiotherapy or ergotherapy. And I can send them to child and adolescent psychiatrists if there are severe behavioral problems.
Psychiater oder zu Beratungsstellen weiterschicken.
In the examination room next door, Tamerlan waits with his mother. The 6-year-old has had stomach pains for 3 days. That's why they initially came to the surgery. The pediatrician will now check whether the child is feeling better. Virtually always, the parents should initially contact a pediatrician. If the surgery is closed, you can call the emergency medical service. The number is 116 117. There you will find out where to find rapid help. In an emergency, one does not go to the pediatrician first. One should call the emergency services direct. Throughout Germany, the emergency services have the phone number 112. And these are indications of an emergency: difficulty in breathing, severe and frequent vomiting, severe stomach pains or poisoning. Also, accidental injuries and severely bleeding wounds, burns and chemical burns are a case for the hospital. Similarly, listlessness or loss of consciousness. when the child does not react to being addressed or shaken. Tamerlan is feeling much better again. His mother should continue to give him his medicine for a few more days. In this case as well, the pediatrician was able to help.